General terms of relating to disease. The term disease broadly refers to any conditions that impairs the normal functioning of the body. Commonly, the term is used to refer specifically to infectious diseases, which are clinically evident diseases that result from the presence of pathogenic microbial agents, including viruses, bacteria, fungi, protozoa, multicellular organisms, and aberrant proteins known as prions. Bacterial infection. A bacterial infection is the proliferation of a harmful strain of bacteria on or inside the body. Bacterial infections have a large impact on public health. Disease can occur at any body sites and can be caused by the organism itself or by the body response to its presence. Bacteria are transmitted to humans through air, water, food, or living vectors. The principal modes of transmission of bacterial infections are contact, airborne droplets, vectors, and vehicular. Preventive measures have a dramatic impact on morbidity and mortality. Such measures include water treatment, immunizations of animals and humans, personal hygiene measures, and safe sex practice. Bacterial resistance to antibiotics is a growing concern, mandating their prudent use. What are the symptoms of a bacterial infections? The symptoms of bacterial infections will depend on the locations of the infections and the type of bacteria. So there are some general signs of bacterial infections, which are fever, feeling tired or fatigued, swollen lymph nodes and the neck, armpits, groin or elsewhere, headaches, nausea or vomiting. What are causes bacterial infections? So a bacterial infections occurs when bacteria enter the body, increase in numbers and cause a reactions in the body. Bacteria can enter the body through an opening in your skin, such as cut or surgical wounds, or through your airways and cause infections like bacterial pneumonia. Bacterial infections can affect the throat, lungs, skin, bowel, and many other parts of the body. Many are mild, some are severe. Examples of bacterial infections include shopping coat, strep throat, air infections, and urinary tract infections. The So what is hepatitis? Hepatitis refers to the inflammatory conditions of the liver. It is commonly the result of the viral infections, but there are other possible causes of hepatitis. This includes autoimmune hepatitis and hepatitis that occurs as a secondary result of medications, drug, toxins, and alcohol. Autoimmune hepatitis is a disease that occurs when your body makes antibodies against your liver tissue. Five main viral classification of hepatitis are hepatitis A, B, C, D. A. A different virus is responsible for each type of virus hepatitis. So first, hepatitis A. Hepatitis A is the result of infections with the hepatitis A virus. This type of hepatitis is an acute short-term disease. Hepatitis B causes hepatitis B. This is often an ongoing chronic conditions. Hepatitis C comes from the hepatitis C virus. Hepatitis C virus is among the most common blood-borne viral infections in the United States and typically present as a long-term conditions. Hepatitis D, this is a rare form of hepatitis that only occurs in conjunction with hepatitis B infections. The hepatitis D virus causes liver inflammations like other strains, but a person cannot contract HDV without an existing hepatitis B infections. So hepatitis A is a waterborne disease that results from exposures to the hepatitis E virus. Hepatitis A is mainly found in areas with poor sanitation and typically result from ingesting fecal matter that contaminates the water supply. Hepatitis E is usually acute but can be particularly dangerous in pregnant women. Common symptoms of infectious hepatitis include fatigue, flu-like symptoms, dark urine, pale stool, abdominal pain, loss of appetite, unexplained weight loss, yellow skin and eyes with maybe signs of jaundice. HIV and AIDS. HIV stands for Human Immunodeficiency Virus. It's a virus that attacks the body immune system. The virus is spread through the specific type of body fluid called CD4 cells, also known as T cells. These special cells help the immune system fight off infections. Untreated HIV reduces the numbers of CD4 cells, the T cells, and the body. Over time, HIV can destroy so many of the cells that the body can no longer fight off infections and disease. In addition, this damage to the immune system make it very difficult for the body to fight off infections and other diseases. If HIV is not treated, it can lead to AIDS, which also make it easier for infections or cancer to take advantage of a very weak immune system. What are the stages of HIV? First is acute HIV, flu-like symptoms that occurs day 2 weeks after contracting HIV. And second is a chronic HIV, also known as the latent or asymptomatic stages, can last for several years. And the last, AIDS, occurs when CD4 cells count falls between 200 cells, make a person vulnerable to opportunistic infections and AIDS-defining conditions. So how HIV transmitted? HIV transmitted through contact with the following body fluids, from most likely to lead to HIV transmission to less likely: blood, semen, vaginal fluid, breast milk, sex without a condom, and sharing needles, even tattoo or piercing needles. How HIV does not transmitted? You cannot become infected with HIV or AIDS through ordinary contact. That means you cannot catch HIV or AIDS by hug, kiss, touch, shaking hands, food, drinks, utensils, clothes, towels, and etc. Bloodborne pathogens. A microorganism present in blood which can cause disease in humans. But there are many different kinds of bloodborne pathogens, but the most notably are the hepatitis A, B, C, and the HIV. So, bloodborne pathogens modes of transmissions are unlock broken skin from a protective barrier against blood-borne pathogens. However, infected blood can enter your system through open sores, cuts, abrasions, acne. And blood-borne pathogens may also be transmitted through the mucous membranes of the eyes, nose, and mouth. For example, a flash of contaminated blood to your eyes, nose, or mouth could result in transmission. So, blood-borne pathogens, body fluids. Blood-borne pathogens such as hepatitis B virus and HIV can be transmitted through contact with infected human blood and other potentially infectious fluids such as semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, peritoneal fluid, amniotic fluid, saliva, comet, and feces. Parasites. Parasites are plants or animals that live on or in a host, getting their nutrients from that host. So what is host? A host is an organism that supports a parasite. Sometimes the host is harmed by the parasites, and sometimes the relationship is neutral. Ectoparasites are parasites that live outside the body. In animals, they live on the skin and can cause itching and rashes. Endoparasites are parasites that live inside the body. For instance, they may live in the blood system, muscle, liver, brain, or digestive system of animals. Parasites are not one size fits all. There are several main categories of parasites that can affect animals and plants. Probably the most studied parasites are the ones that affect humans. Broadly grouped, they include protozoa, helminths, and arthropods. More familiar, less mysterious names are lice, ticks, mites, bedbugs, flies, and tapeworms. There are three main classes of parasites that can cause disease in humans, which is protozoa, helminths, and ectoparasites.